A great number of patients I see day to day in a clinic suffer from constipation. Many gynecological problems get aggravated by potty problems. Recovery after surgery slows down. Stitches get ripped. Some people even develop hernia. Bowel and urine habits are health indicators. We humans have been roaming the earth for 6 million years. However, the concept of having great potty in the morning is not clear for many. It's not that complex though. Relying only on medicine is not smart. If you know the ingredients of potty, then perhaps you can back calculate what our daily potty is made up of. Improve on each ingredient, get a great potty in the morning. I have shared 4 practical tips after going through medical books, journals and new researches. On top of that, we will be sharing 5 more bonus, extremely useful, free steps in life which will improve your mornings. Scientific but surprising facts. What is the potty made up of? 3 things. Large amount of water, fiber, mostly undigested vegetable and fruit fiber. Number 3 is shocking. Half of the weight of your potty is bacteria from our colon. Our body contains only 37 trillion human cells and whooping 82 trillion microbes. They are the tenants of our body. Most bacteria live in the intestinal tract. Modern researchers show that these friendly microbes not only protect our guts but also provide our body with various beneficial chemicals and vitamins. Fight infection, even prevents cancer. So, to achieve a great potty, you have to nourish these 3 things every day regularly. Those 4 hormone remedies therefore are fiber, enough water, physical activity and timing of potty. Fiber first. Fiber or roughage is an important ingredient in food. Just like protein, fat, carbohydrates, if you are of my age, fiber was not taught when you went to school. But today's boys and girls learn loud and clear that fiber is an essential ingredient in our diet, which is actually a waste to human. Your body cannot digest fiber, and there lies the secret success key. The food items our body manages to digest is not great for potty. Eating a nice white rasgulla won't make much potty, but eating fiber will make potty very healthy. In modern countries, our diet lacks fiber. Fibers are of 2 types. One is insoluble and other is mixable with water. They work differently. Mix both types of fibers in a diet, easily found in vegetarian foods. Insoluble fiber does not dissolve in water and remain virtually unbroken even when attacked by friendly colon bacteria. Retains water effectively, which helps increase the weight of your potty. If the amount of potty is small, you probably need more of this type of fiber. Soluble fiber forms a gel-like substance that, together with other waste products in the bowel, smoothens the bowel. It glides out from our body every morning. Not only that, fiber lowers cholesterol level and avoids glucose rush into your blood. Fantastic for diabetes control. Constipation can be cured by consuming healthy fiber regularly over a long period of time, but you need to drink enough water with it. Only then fiber can work. Otherwise, no matter how much fiber you eat, you will stay unhappy. Next, water. Once food is digested in the stomach, it moves to the colon. This is the waiting area for potty. This is where potty sleeps through the night before coming out the next morning. Colon never sleeps. If the body is deficient in water, the colon absorbs water from the potty in this waiting area. It makes potty harder. The more the body is dry, the colon steals more and more water from potty. The potty next day will be hard. We will face rough time to push that rocky hard potty out. If the body has enough supply of water, the slippery mucus lining of colon will remain fresh. Colon will not need to pull out water from potty. Voila! Soft potty next day. Smile. The question next is how much water to drink. The need for water intake varies from person to person. In a hot, humid climate like India, one needs to drink at least 3 liters of water. When we sweat, we need to drink more water. How can you tell if you had enough water? Here is a tip. Every time you go to the washroom, look at the pan. If the color of the urine is completely colorless or just light yellow, then you are meeting your water needs. If it looks yellow enough right at the first glance, then you are probably dry. It means within the next 2 days, you will have dry potty coming. body movements. How does this help for potty? Nerves are not only inside our brain. We need nerves to digest food too. There are about 500 million nerves in our stomach. Why? Take this simple example. We swallow in an average 2000 times a day. Each swallowing requires 40 muscles in the throat. The food travels then 8 meters, passing through the stomach and small intestine. Very happening place. Next morning, out by a little hole called anus. Each step needs a lot of nerves for their movement. Stomach and small intestine work hard to digest food. Like rowing on a boat, the small bowel moves back and forth for hours following a meal. Just like Olympic rowing competition. It alternates between pushing the food from one side to another side. After the body absorbs the vitamin and nutrients from food, an electric wave from stomach flushes out any remaining food to the large intestine. The small intestine then stays sparkling clean. The master of all movements inside the stomach is the enteric nervous system or ENS. If we move regularly, nerve systems of the stomach feels energized. If we move the body regularly through regular exercise, walking, then digestion and bowels feel happier. That's why when we stay inactive, we develop constipation. In some diseases like diabetes, glucose accumulates on the stomach nerves. The nerves become dull. Constipation worsens. Insufficient exercise can blunt the function of these nerves as one gets older. For a happy morning, get up and walk all day. Time for potty. Timing is so important. If you go to potty each day at different time, the large intestine gets very confused. In the first 2 decades of life, the large intestine copes well with that confusion. Problem starts from mid-30s. After 40, constipation is a genuine issue. It is crucial to develop the habit of using toilet from childhood. So, we naturally go when we wake up. We need to form a habit. The intestine will then receive a daily signal. With that habit, automatically you will have a potty urge in the morning even when you are 70 years of age. Those who cannot use toilet in the morning may opt for a different time later in the day. But the secret is it has to be roughly the same time. So, there are 4 homemade tricks for potty you have just listened. Next up, 5 scientific facts to be aware so that you can use them for your benefit. Side effects of medicine. Certain medications can also cause constipation as a side effect. Some examples are long-term use of certain antacid medication, calcium channel blockers, and diuretic type blood pressure medication. Diuretic drug control blood pressure by removing more water from the body through urine. Body dries up. To supply the body, colon absorbs water from the potty, then potty dries up. Also, some pain medications, some mood or depression medication, etc. can be responsible for constipation. Stress. Stress causes constipation. There are 2 types of stress. One is acute stress, which starts suddenly, occurs for a short period of time, but then goes away. This type of stress is not that bad for long-term health. Chronic stress, on the other hand, goes on for a long time. With no quick fix, we suffer from anxiety over weeks and months. A sudden panic attack during an exam is an acute stress. At this time, many people get diarrhea. So when I say that stress can cause constipation, many don't want to believe that. The real danger lies in the chronic stress. This stress comes in many forms. Missing a return flight from Delhi and blaming yourself for that. Getting involved in politics with a toxic boss at work, constant family strife, guilt, fear, being in hospital, or news of a difficult diagnosis. These are all causes of chronic stress. Chronic stress secretes some chemicals in the body. Nerve system of the stomach gets confused with that. Bowel becomes lethargic and does not move well, resulting in constipation. Sitting in correct posture. Correct posture is important while taking a poop. The whole food pipe measures a lengthy 8 meters from the mouth to anus. The last few inches of this long road have a sudden twist at the junction of rectum and the last couple of inches of the food pipe known as anal canal. If this fold can be straightened during moving bowel, it will be convenient to move bowel with less strain. You will be surprised to hear that the way we Indians used to move bowel with full squat is the best position to move bowel. As it unfolds, that bent. Today, many of us use Western toilets and defecate sitting on chairs. Piles, diverticulitis, and constipation problems are increasing because of that twist or fold not opening properly in a sitting position. In 2002, Israeli doctor Dov Sikirov did a strange study on this. He found that people who have no place to sit at home except on a Western toilet can continue to sit on a Western toilet with knees folded. They can use a small stool below their feet. This brings the knees closer to the stomach. Even though it is not completely an Indian style, but at least some help to unfold the twist without completely demolishing the toilet. And yes, various researchers suggest stomach gets upset if we keep on checking mobiles sitting in the toilet, so avoid that. Food diary. Whenever we develop constipation, we search for the cause in the diet. If we find a cause, then we stop eating that item. By doing that, we sometimes get rid of beneficial food from our diet. Maybe it was not the culprit after all. We somehow came to the conjecture that it must have triggered the constipation. Please use caution in such circumstances. Keep a food diary. What foods you are eating and what time of the day and the condition of the potty next day, good, average or hard, write them down. After a month, analyze it. Then only it is possible to confirm whether that particular food item was really guilty. Next, patience. Yes, one more thing before I finish. Any good practice for potty, or for that matter, potty medicine, may take up to 4 days to work. Please do not get upset before that. Never say taking fiber, doing exercise or drinking water are not working for you. After all, you have a human body. It will definitely work. Just have some patience. Giving up is not an option.